Hey everyone, it is day 13 post-op, Tuesday, March 4th, and I'm feeling even better today, feeling more independent, and yeah, no fevers, no complications, really just resting and establishing my new normal routine, starting each day with prayer and meditation. That isn't new. That's something I usually do, but having more extended time for that. And then breakfast, washing up, taking a nap, then lunch, and yeah, more mindfulness and meditation, prayer, and then taking another nap, and then it's dinner time, and then carving out some time for other types of fun mental health activities, such as coloring. So I wanted to actually go through some of the surgery must-haves and recovery must-haves for anybody who is on this journey or wondering how to prepare for this, or just curious. And so one of the first must-haves I have to mention is this mastectomy pillow. It's actually a 3-part pillow, kind of like a trifold. These two sides go under the armpits, which is extremely helpful in the front, provides extra padding and cushioning and protects the mastectomy sites, while the armpits, the sides actually protect where the lymph nodes were removed. So it's been really helpful. It also has pockets in the front for heating pads, cooling pads, which I've used these pockets quite a bit. They come in handy. They're also great for holding cell phones or any other odds and ends. And I've been taking this with me like literally everywhere. It's helpful when I'm riding in the car to and from appointments. My first ride in the car home from the hospital when I was discharged, I remember other cancer warriors mentioning that you're going to feel every bump along the way, and that was so accurate. And so they had recommended having the mastectomy pillow, but in addition to that, whenever I ride in the car, I also have this actually came as a set, which is a seatbelt cover, and it provides a lot of extra cushion. These parts attached to the seatbelt, and then kind of goes across the shoulder for additional protection of the surgery sites. Other important things are the mastectomy blouses, gowns, robes. These are especially designed with drain pockets and pouches on the inside to hold the drains that you'll have for the first week or two after surgery. They also, I recommend front closure because it's super easy to check your drains, and for self-care. It's a mastectomy gown that also has the side closure with Velcro. Velcro is a lifesaver. You'll be surprised if you have to go through this type of surgery, just how diminished your upper body strength is. And so having something that's easy on, easy off, and easy to manipulate, that you don't have to put on over your head, is especially essential and helps foster more independence post-op. So this one has the side closure, and it goes all the way, the side closures all the way down the side. So I've got lots of Velcro all the way down the side, so it's really easy on, easy off. Some other important things, as I mentioned, the mental health piece is really important. My dad would always say the mind of a person is the person, the mind of the man is the man. And so it's important to, really constantly reaffirm and affirm yourself, and this journey that you're going through and what you feel is okay. You're not always every day's not gonna feel great. And it's okay to not be okay. And so also finding ways to uplift yourself is essential. So shout out to a dear colleague of mine who sent me this Healing Affirmations coloring book that has lots of really inspiring quotes and phrases to kind of help during each day. So you can kind of see I've been doing some coloring. I do like some books that are focused on humor as well, but really creative ways to help you process your journey. Make sure you get coloring pencils, markers, crayon, something to color with as well. And a lot of these are actually sold in sets. This comes in handy not only during the post-op period, but if you have to do chemo and you're sitting in that chair for hours, that'll come in handy as well. Great way to pass the time. Something else I found really helpful that I didn't realize would be so helpful is an eye mask. You'll be sleeping, in the hospital at first, where there are always lights on, as well as when you come home and you can't lie down flat. And so sleeping upright, often in a recliner, maybe in the living room, which is probably the busiest room in the house. It's nice to have a way to kind of simulate darkness and be able to fall asleep. So I've been able to, and I tend to be a very light sleeper, and it's really hard for me to fall asleep generally, but I haven't had any problems with sleeping post-op, and it's been really helpful having this to kind of block out any additional light. Something else to have is a handy blanket, something that's nice and soft. This one is shout out to one of my aunts who got this for me. I'm trying to find the right side up, but it's basically a word cloud. But the fabric of the blanket is very, very soft and just helps add to the comfort when you're trying to get, super comfortable and go to sleep. But have a good, nice, warm blanket so that when you are trying to find your sleep, you can. Some folks, for sleeping purposes, will try to use wedge pillows. I was initially going that route, and my daughter encouraged me to say, look for adjustable beds, adjustable bed bases, and because I figured they were just too exorbitantly priced, it wasn't going to be my price range, no point in looking. And I happened to find one that was on sale. And so I ordered it and have been very pleased. So I now am able to move from my recliner to my bed, and I'm basically still sleeping in an upright position, and there's no place like your own bed, being able to sleep in post-op. Additionally, the recliner I mentioned, don't just get any recliner. As I said before, upper body strength is significantly reduced, so you won't even have the upper body strength to necessarily be able to pull or push a lever to recline. So one thing that several other cancer warriors had mentioned was to, if you can afford it, or if you can borrow one, get an electric recliner where you just push a button and it reclines for you. I also found a nice deal on Wayfair for a recliner that actually not only reclines, but can push you into a standing position so that you don't have to use your trunk or your torso, you don't have to use your arms to push yourself up or to sit down, which is something else. It's another limitation, restriction, post-surgery. There is no weight bearing on your upper arms, upper body. You won't be able to push yourself up or down from a seated position. And so that's really essential to have some means to do that if you don't have someone who can help you. And as a single mom, and my kids have been amazing in helping me, but when they're on the go or they have other things that they're trying to manage, it's been good that I've had that sense of independence where I can just push a button on my recliner and it stands me up without having to wait on someone to come help me get up. So next thing I'll show you, there are a couple of helpful items for your bathroom and some easy modifications. A lot of things are available on Amazon, Wayfair, Walmart, other places that you can find. So let's take a walk to the bathroom. All right, so here we are in my bathroom, and there were several things that I did to just make life easier so that I can navigate and manage on my own. But first things first, let's talk about managing drains. Drain care is essential when you first get home. It's going to be the first assignment. And so making sure that you have some sort of a chart to record your output. Initially, you're going to be recording output 2 to 3 times a day, if not more. And then it'll decrease over time. Currently, right now, only having to empty one drain, and I only do that once a day because I am well on the way to healing. But having something here for that, and then also having some alcohol pads or wipes or just a bottle of alcohol with, some sterile gauze to clean off the drain insertion points if for any reason it should get soiled. Something else to keep in mind, you'll have to change your dressings, and so you want to make sure you get some additional dressings from the hospital on the way home, or you can also, they come in any first aid kit. Speaking of the hospital and on the way home, they will usually there's a bin that you use, a basin, as well as like a little pitcher. A colleague of mine or friend of mine who worked in home health actually suggested make sure you take home everything the hospital provides you because it's yours. You also want to have a set of towels, a couple of sets of towels, washcloths, things to just help as you gain independence. You might have home health care, you may not, you may have family, friends, relatives who are helping you with that. You're going to need to use clean linens and clean towels every single day, so make sure you have plenty of those and then store the rest where you can reach them. You can see I have an over the cabinet toilet before surgery, things that were there that I knew I was going to need, like all of my extra towels. I moved them and relocated them because I couldn't reach that high. So I just placed them on a desk or in my closet on my dresser so that I could actually reach them and I don't have to go up too high. Other things that were really helpful, having a drain pouch that's shower safe so that your drains aren't dangling. When you do take a shower, you can just put the pouch around your neck and then put the drains in the pouch. And then this is something really cool that another cancer patient recommended to me, but this is actually bendable. So this shower brush can be bent to help you wash your back independently if you don't have additional assistance. Some other things for showering safety. This is actually just a suction cup bar that came with the shower bench. I definitely recommend a shower bench. I initially had it on my Amazon wish list, then removed it because I was like, I am not old people. I will be just fine, won't need it, until right after surgery when I realized how diminished my energy level was as well as my physical strength, and so realized I do need this and safety first. So I got a folding shower bench and it came with this handy suction bar. So it's allowed me to modify my shower and make it shower safe. My landlord will be coming in to install additional shower bars as well as a detachable handheld shower apparatus, which is highly recommended so that you can control the flow of water and keep your incisions dry. Something else, bath sponges. These require very little water. You just put a few drops of water in it and then you're able to sponge bathe. And so that has been a lifesaver, helping me to do some sponge baths on my own. This right here, Dr. Teal's foaming bath. You cannot take a bath right after right after the surgery. You can't take a bath for probably the first few weeks, if not longer after surgery. However, this is great for use with a sitz bath. And if you're not familiar with a sitz bath, what that is, basically it's kind of like a portable bidet that you can, this one's collapsible, that you can basically seat it on your toilet, and once you fill it with warm water, you can put in some of that Teal sitz bath, and it creates like this bubble bath effect, and it's like a little fountain. Make sure you get lots of Clorox wipes, super helpful to sanitize and disinfect your bathroom every day. And then you'll notice I also have this handheld sprayer. It's a handheld bidet sprayer available on Amazon for only like $20. And I was able to install it myself. And this has also been a lifesaver for self-care and being. It has a variety of different pressures depending on how firmly you press the valve. So you can do anything from a trickle to a full-on heavy spray. But this is also really helpful with personal care and hygiene. And wonderful tips and tricks to help you through your post recovery period. And not just for folks who are recovering from a mastectomy surgery, but for anyone who's dealing with any kind of upper arm, torso related surgery like heart surgery, lung surgery, anything in the main body cavity, as well as for postpartum patients and women who've recently given childbirth. Super helpful. Something else to consider is your closet. I used to keep my clothes in baskets at the top of my closet. You can see I have really high ceilings, 12-foot ceilings, and so making sure that I could reach the clothes that I needed every day. So undergarments, shirts and blouses, towels and things, I had to relocate down low into my dresser drawers. You'll also notice that I have my hair in an updo. I went with a no maintenance hairstyle. I actually stayed up a couple hours the night before surgery to try to do this so that I wouldn't have to worry about managing my hair. And this has been extremely helpful. After surgery, my kids were helping me with scarves and tying my hair and that kind of thing when I couldn't lift my arms, which, you know, and now that I'm able to tie my hair, I still can't lift my arms very high, but I am able to lower my head enough so that I can tie my hair. But finding ways to manage independently really goes a long way, and kind of thinking about these little details will have payoff in big dividends. You also want to have a go bag for the hospital. Shout out to my Aunt Barb Lockett, who hooked me up with this and many other goodies that were packed in this bag. You also want to make sure you have Tylenol extra strength. You're not able to take many of the other painkillers with like ibuprofen and like Advil, Motrin. You cannot take those because they are blood thinners, and after surgery you don't want excessive bleeding. So acetaminophen or Tylenol is recommended, and then you can alternate with whatever prescription medications your doctor prescribes. I think that's about it. Oh, if I didn't mention it, ice packs, heating pad. I actually have a heating pad that covers my entire back and then wraps kind of around my neck and shoulders, which has been immensely helpful as well. Prior to surgery, I've kind of had a history of muscle spasms and back aches and that kind of thing. And so before surgery, I was not able to take any, muscle relaxers or anything like that for about a week before surgery. And so it was really nice to have some sort of a therapeutic, non-medicinal way to help alleviate some of those issues. And then after surgery, it has been a lifesaver. It's been just very comforting to have a warm, it gives you like a warm blanket feeling. If you manage to get one with a massager, like just that kind of vibrates, that's also great, but not necessary. But I think that's all that I can think of. I am going to try to put a few links to some of the items I mentioned in the description. And then in terms of mastectomy wear and mastectomy undergarments, another company that I would highly recommend is Ana Ono. They actually specialize in mastectomy wear, post-surgical bras, both for unilateral and bilateral mastectomies, as well as other types of garments for the different types of cancer treatments that you may be experiencing, or if you have a friend, relative, loved one who's going through this journey, you could recommend that as well. And I'll put the link in the description. I think that's all I have. Thank you so much for being a part of my journey, for being here to support me, for providing, a lot of the things that I needed, absolutely needed. One thing you don't think about when you initially, some people may, but with the cancer diagnosis, you think about, of course, confronting your own mortality. And then for me, of course, thinking about loss of my identity, loss of breast, loss of hair, loss of independence. And, so I think in the midst of thinking about all of those things, it can be easy to forget about the loss of finances, like the inability to work, and also the increase in medical bills that come along with that. So there are some assistance programs to help with like medical co-pays that I've been finding out from other cancer warriors, and I'll try to collect some of that information and share it out with anyone who's on this journey, or if you know someone who's on this journey, if you can share that with them. But also just having a village around me to help me with some things that I needed, from basic clothing to meals. Shout out to my church family, my colleagues at work who've been sending gift baskets and gift cards, and some family friends who've sent fruit baskets, and everyone has just really showered me in love and looking out for some of my most basic and essential needs, and not only for me, but also for my family. I really appreciate you. I love you, and you've made this journey so much more, not just endurable and doable, but also enjoyable. So thank you. Love you. Take care.